All right, ladies, gentlemen, children, everyone out there, Bob and I have treated thousands and thousands of patients with shoulder pain.
I'll count them out.
Yeah, bursitis, impingement, rotator cuff problems, and we're going to show you the most effective exercises to self-treat your shoulders to get them better at home. So hold on, we'll get right
10
to
exercises.
the Big 10. Yeah, we'll call it the Big 10.
Big 10.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, we're going to show 10 exercises. All 10 of them are not going to be for your shoulder, but try them. You'll know if they're good because they're going to feel good while you're doing them and afterwards. If any of them create sharp pain, stop. It is not for your shoulder. Wait till it gets better. Let's start with number 1.
The most benign.
Benign.
Right.
Ooh, that's a good word, Bob. Yeah, so your shoulder's really sore and you don't want it to get stiff and you cannot lift it up. It hurts. Typically, you can do this pendulum or Codman's exercise, very commonly prescribed by therapists.
Very
and doctors.
relaxed.
So this is the shoulder. Right. I always tell my patients just to pretend your arm is like jello and there's no muscles in it. And to get it to move, you have to get your body to move. Forward and backwards.
Like elephant trunk.
Yeah, elephant trunk. And the elephant has got a very lax trunk.
Right.
And then right, back and forth, right to left. This should feel good. It keeps the shoulder from getting tight. When it's tight and sore and painful,
and
make
now it's
circles.
doing circles,
Yep.
right?
You know, and you can do these for 10 to 30 seconds. And then back. Once it starts feeling better and you can get on to the next exercises, you don't have to continue this
And
one.
you can do it throughout the day.
Yep, throughout the day. You can even do it off the side on your chair if you want. It doesn't work quite so well. Now, when it's feeling better, number 2, simply take
We'll stop.
a ball. Okay, the second exercise is to get the arm to start stretching so you can reach up again. Take a ball like Bob has, or if you have a big exercise ball, it works well.
Excuse me, did you say sex exercise?
Bob, it's a family show. I wouldn't even consider saying that type of
second exercise.
Second.
You can have a small ball or a big ball.
Grab the ball anyways. Put one hand on there and roll it forward. There you go.
This one you can do in a seated position or standing.
Right. And you can use both hands. If the other one is still sore, use the other one to kind of help. Stretch. Just go to the point of a little bit of pain. Stretch. No sharp pain. Work with it. It may take a few days. Do it for about 10 to 30 seconds. And 3 times a day. Okay, we'll go to number 3. Okay, number 3 is just to get the arm to come up. You can either take your hand like Bob is doing, clasp them together.
Pray a little bit.
Yeah, use the good shoulder to help the sore shoulder.
Sore? Good.
Really doesn't matter because it's hard to tell.
Right.
On this, it does matter. This is my sore shoulder. Grab a stick or a cane.
Palm forward.
Yep.
Back toward you.
Yep. Or if your thumbs are both pointing forward, then you know you're doing it right. And just this arm is going to help this one go up as far as comfortable. Don't overdo it.
Same with this
Yep.
one.
5 to 10 repetitions, 3 times a day until you move on to the next one. Okay. Number 4, simply get extension of the shoulder to go back. It really works well to use a stick. It doesn't have to be a real long one.
Again, thumbs up.
Yep. And then go behind you. So if from the back side, it's here. This is the one being stretched behind you. Don't let it come out to the side like this. Make sure it stays directly behind that shoulder.
And farther and farther if you can.
Yep. I like this one. I do this one just for maintenance. All right. It's like paddling a canoe. Number 5's coming up. Okay, this one is the motion called internal rotation, or be able to get your hand up behind your back like this.
Yeah, you'll find if it's painful, it quite often won't go up that high on the back.
Right. Don't push it too hard. Just be gentle with it. You can use a stick or a belt. If you have a belt, take it like this. So you have a loop there. And then get it behind you like this.
A slippery stick works better.
Yeah, something that has a little shine to it. Same with a belt, a slippery belt, because it rubs on your clothing. Don't do it bareback.
Don't get any slivers in your back.
Make sure you got a nice, smooth, sliverless stick. There, and you simply go up, stretch, and back, and do it about 10 repetitions. Don't overdo it. Do
More
that
and more.
3 times a day. What?
More and more.
More and more. Next. Okay, number 6 is the chicken wing. This one is a little advanced. Be cautious with it, but there will be a time your shoulder's ready. You do need a stick, a longer stick.
If you have rheumatoid arthritis or if your shoulders tend to dislocate,
Right.
don't do this one.
Yep, that double jointed thing, stay away from it. So with this, I tell people point their thumb
Thumbs down, right?
grab the
Bottom
stick.
one, thumbs up.
This is the arm that's getting stretched down at the bottom. Palm away from the body, like Bob said, thumb up.
I'll give them a side view.
Okay. And then you can do this like we just did
Right.
to warm it up.
Warm up.
And then gently pull down with the top away from your head. Don't
Miss the head, right?
bunk yourself like that. And a gentle stretch, pulling the arm away.
Don't go like this.
Yeah, right. Yeah. No.
Move just the stick.
Yep. No bowing. Just the stick. And about, again, 10 repetitions.
And it bears repeating. Do the ones that help.
Right.
Don't
exactly.
do all 10 of these.
Exactly right. Coming up next. And number 7, the Statue of Liberty stretch. This is to get your arm to really extend up so you can do overhead work. Take a stick 4 to 5 feet long.
Do I need a torch?
Yeah, well, no, Bob, you really don't, but you could. But be careful. So you can put it on the floor like this, or you can put it on your chair or whatever you're
Especially
sitting
if
on.
it's tall.
Yep. Make sure you have a rubber tip on the bottom, or you can have
You can put it in a shoe.
in the shoe. Obviously, the shoe's not on your foot, just the shoe, and then you put it in there so it doesn't slide on the
Right.
floor or damage anything. And you simply grab up as high as you can. You're going to hold tight. You're not going to let your hand slip down, and simply lean forward. And it's amazing the stretch and the pull, the traction you
The
get.
decompression.
Yep. It really works that shoulder. And then you're just going to work it as tolerated. If you get sharp pain, don't go
And you
that
can try
far.
to keep it a little farther after you do it a few times.
Yep. And here on the chair, I could go here. Again, if you have a hard chair, it's going to slip around. You could put the shoe there and put your stick right where your heel
I've had
goes.
patients that love this one, Brad.
Yep. Stretch. I had that. My first one I did, patient I used this on a number of years ago. He was a 13-year-old pitcher for hardball.
Gotcha.
And he needed that overhead, and it worked really well with him. So
Right.
very good. We'll go to number 8. Okay, the last 2 exercises are strengthening exercises. By this time, you're able to reach fairly high above your head without pain.
Last 3.
3, okay. You're right. Thank you, Bob. You can do this. Bob's going to do the W's. You can do it with resistance with a band like this.
What's nice, you can do this in your chair,
Yeah.
office chair.
Exactly.
See the W? For win.
Now, going like this isn't the best way to do it with resistance. I'll show you a better way. But make sure you
You squeeze the shoulder blades together.
right back there. You're trying to touch them together. If you can take your band and anchor it around something, we use a wall anchor on the wall. You can use the door. You can use a handrail. Where is that thing? Yeah, here it is. This usually comes
Oh, sure.
with these. You can put that in the door, and then you simply get resistance. It really is helpful to add that resistance once you get strong enough. 10 repetitions is a good number to go to like the rest of them. Okay, now we're going to go to number 9.
All right.
Okay, number 9. This is specific to one of the rotator cuff muscles, your external rotators, which goes this direction.
Right.
Elbow stays by the rib cage. It doesn't move. It doesn't come out. It doesn't go like this. And we have this motion. You can do it lying on your side like Bob is doing with a weight. He's got a dumbbell there. Notice his elbow position stays right there on the elbow. It's a nice way to do it. If you have bands and you have the anchor that goes in the door, it would connect up like this and you close the door. If you have it set up with the wall anchor, it works well. I'm going to put it in there. This one's not doing anything. My left arm is doing the exercise.
Keep it in.
Yep. If you got something like anything, just squeeze it in with your elbow.
All right.
So now that forces me, if this drops out, that means my elbow got too far away from my body. Keep it in. I've done that with a lot of times with patients. I put a towel roll in there.
Now, these are small muscles, so you don't need much weight or resistance.
Right. I can already feel that muscle at wait, no, it's
Terry's minor, Terry's major.
yeah, the external rotator getting tired. It's a small muscle,
And
but
infraspinatus, spinatus.
yes, very critical. All right, next. Last but not least, this is actually probably one of those exercises that really gets skipped. Bob, wouldn't you agree?
Right.
We want to strengthen the muscles that stabilize the scapula, the shoulder blade.
Shoulder blade.
You can start.
Very important.
Yep, you can start beginning like this against the wall. Your elbows must stay locked. Don't bend them, lock them, and then all the motion comes from the shoulder blades.
You can do it a quadruped position too.
Yep. There we go. A lot of motion. It's amazing how much the shoulder blades actually slide across the rib cage, and that's critical for activities with your shoulders. So make sure you get that one in for sure as well. Bob, that was 10. The Big 10. Not only was it the Big 10, but it was the Big 10.
There we go.
There you go. Good luck with your shoulders. They will get better. They will improve, and I don't know what else to say.
Have fun.